Let's talk more about vaccines. The U.S. has now hit President Biden's vaccination target of getting 70% of adults at least one dose, but it's a month after their July 4th goal. So how significant do you see that number, and does the timing hitting that goal late matter?
Well, the later we hit these goals, of course, the more it matters, because the more you're seeing virus spread, the more you're seeing variants emerge. And it's important for people to understand that, again, we've got to get more people vaccinated. That said, I don't want to be Mr. Downer the whole time, or Dr. Downer the whole time. Vaccinations are up 25% this week. That is significant, and they're up most in places that had the lowest vaccination rates. We're getting between 500,000 and 750,000 people vaccinated every single day. We need to normalize the positive health behaviors that are going on out there, instead of focusing on and normalizing the negative health behaviors. We need to help people overcome their psychological and their real world barriers to getting vaccinated. We know many people still have difficulty because they're in the gig economy, going to get vaccinated and worrying about not being able to work the next day due to vaccine side effects. We know people have legitimate questions that, when answered, can help bring them to a place where they get vaccinated. So lots of work to be done, but lots of progress that our country and the public health community should be proud of.
Let's talk about more specifics that can be done, and I want to zoom into one of the hot spots in America right now, Louisiana. Hospitals there are overwhelmed. I'm sure you're hearing reports of it, Dr. Adams. There are more than 11,000 cases reported since just Friday, and vaccination rates there are still some of the lowest in the country at just 37%. So they're offering free entry to Louisiana state parks, free drinks, even the chance to win $100,000 a week. What else should the government or public health leaders be doing?
Well, you're right, and I want everyone watching today to know we are not crying wolf here. This surge that we're going through right now has every potential to be, and already looks to be, the worst surge we faced so far. We're at 50,000 hospitalizations today in this country, which is where we were in February of last year. February of last year, no vaccines, not enough testing, not enough masks to go around. We were at 50,000 hospitalizations. We are there and still rising in this country, but there is more that we can do. And as you mentioned, there are incentives, but I believe that, as with every other vaccine in this country where we have high vaccination rates, schools are going to be important. We need to make sure we're utilizing them as touch points. I loved President Biden's idea of pop-up clinics at schools. That was a suggestion I'd made to Congress a few weeks ago. And work sites. There are people who will resist doing something because the president says so, because the government says so, because local politicians say so. But if their business, their place of employment says you have to do this in order to work here, they will do it. And so the more we can empower and engage businesses to encourage, promote, and in some places require vaccinations, the more we'll see those rates tick up.